Hey guys, welcome to my second YouTube video. So, like I said in the previous video, today we're going to be talking about what to expect if it's your first antenatal visit. So, before we get into it, I want to start by saying this video is for pregnant women who are starting their antenatal care, whether it's in a public clinic or a private doctor or a gynecologist. So any pregnant lady whose first time to attend antenatal care, this video is for you. So guys, it is very important for you to start your antenatal care as soon as you find out that you are pregnant. As soon as 5 weeks pregnant, 8 weeks pregnant, 12 weeks, it's very, very important to start your antenatal visit as soon as you find out that you're pregnant. The reason why I say that is because when you first come for your antenatal visit, we check your well-being as a pregnant woman. So you're going to be checking for each and everything. For example, we'll check your high blood pressure to see whether it's high or low. So if it is high, we're gonna take the necessary steps to prevent the complications that come with having high blood pressure in pregnancy. Also gonna be checking things like your urine, whether you have STI, which is sexually transmitted infections, or urinary tract infections, or if you have things like kidney problems or liver problems. Such things can be detected when we check your urine. So if we find abnormality, then it is very important that we refer you to our gynecologist as soon as possible to prevent or minimize the complications that will arise from having abnormal kidneys, for example, when you are pregnant. So another reason why you should start your antenatal care as soon as you find out that you're pregnant is so that you are prescribed the correct pregnancy supplement. Because we find that some patients, some pregnant women, they just go buy over-the-counter supplements. You find that they're buying the same thing, but because it's of a different brand, so they end up actually taking too much of the same thing, and they are not aware of that. So it's important that you start early so that you prescribe the correct supplement, so that they will assist in the well-being and the development of the baby and your whole pregnancy for the whole life. So guys, the first item that you need to bring when you come for your antenatal visit, your first antenatal visit, is guys, you need to bring snacks because the time you spend when it's your first antenatal visit is going to be the longest time you spend when you come to the clinic or when you go to the gynecologist or when you go to the doctor for your first antenatal visit, because of the amount of time you spend with one person due to the amount of work and the amount of information that we need to collect from you and that we also need to give you. So for example, I'll make an example with myself. Most of the time when a person has come for their first antenatal care, I spend about 20 to 30 minutes depending also on what I find abnormal on the person. So if you have a person who has an abnormal blood pressure or maybe has uncontrolled chronic illness, obviously you're going to have to spend a few more minutes with that person, either to refer them or to explain to them the complications that the uncontrolled disease can bring to the pregnancy and how it can affect the baby, and also how we can fix it or try to control it.
So you can bring your snacks such as fruits like your banana. So a banana, guys, is important when you're pregnant because it also helps to regulate your blood pressure. It also has it's like a chemical that all pregnant women need so that the development of their baby is normal. For instance, so folates assist in the normal development of the spine and also the brain. So it's very important. You can also have fruits like your orange. As we are approaching winter now, so orange is important because you're gonna need the vitamin C. So orange is important because you're gonna need the vitamin C to assist your immune system to help you to not get flu. So another thing that you can bring as a snack is peanuts, because peanuts they also provide the folate. So guys, if you stay in a community where your tap water is clean and safe to drink, you can bring your tap water you can put it in a nice bottle so that you have it ready because it's also important to stay hydrated during pregnancy. Also, drinking at least like a liter of water a day when you're pregnant will assist you or will reduce the chances of you getting urinary tract infections. But if you stay in a community like mine, where the tap water is most of the time not safe to drink, you can either buy water, you can buy purified water, or you can start by boiling the water first. And then once it has cooled down, then you put it inside a bottle because it's very important that you drink safe and clean water when you're pregnant to prevent stomach problems or stomach infections. Right. So another thing that you should bring when it's your first antenatal visit is the medication that you are currently taking. So, for example, let's say you were sick maybe 3 or 2 weeks ago, and then you went to the doctor and then they gave you medication. It's important that you bring the medication so that we see the names of the medication and whether they have an effect on the pregnancy or not. So if they have a negative impact on your pregnancy or your baby's development, then we have to change them to the ones that are not harmful. Also, if you are on a chronic medication, like maybe if you have high blood pressure, you have diabetes, you have HIV, you need to bring your medication as well because some medication you need to change them to be like some you need to adjust the doses, and then others you need to change them completely to other medications so that they're not harmful to your baby. So, for example, if you are on high blood pressure medication, we'll change them to the ones that are for pregnant women only to prevent abnormality.
Right. So when you come for your first visit, there will be information that we're going to be needing from you. So the first thing we're gonna ask is your obstetrical history. So basically that just means your previous pregnancies as well as your current pregnancy. So for example, we're gonna ask you how many pregnancies have you had in the past, excluding the one that you are carrying right now. So if you've had, for example, 4 pregnancies, you're gonna tell us like pregnancy number one was maybe in 2010, and then pregnancy number two, 2015, number three, 2018, number four, 2020, for example. Then you're also gonna tell us whether you carried those pregnancies the whole 9 months or you had some preterm pregnancies. And then we're gonna also ask for the birth weight of the baby. Now the reason why we ask for the birth weight of the previous babies, so that we get an idea of the ranges of all the children's weight. So there are some women who have very big babies, so then so that we can plan properly when it's time for labor. So you're gonna also ask if you delivered your baby normally, like you've had a normal vaginal birth, or you've had a cesarean section. Cesarean section is just to deliver the baby with the operation. The reason why we ask that is so that we find out why you delivered your baby with the operation, and if maybe we can prevent that. So, for example, if you have had a very long labor, your baby started to have an abnormal heartbeat, or if your pelvis is very small, too small for a baby to pass through, such things, so that we can also refer you to the gynecologist if you're going to meet the gynecologist. Another reason why we ask for whether you carried your baby the whole 9 months or not, so that we also refer you to the gynecologist if you have had a history of that and you don't know why. So basically, the importance of your obstetrical history is so that we classify your pregnancy, whether it's a low risk or a high risk pregnancy. So a low risk is the one that has low risk of complications, low risk of birth complications, low risk of having abnormal or a baby with congenital abnormality. It's basically a pregnancy that can be managed by midwives at a clinic from start to finish. And then a high risk pregnancy is the one that has a high risk of complications, high risk of congenital abnormalities, a high risk also on the mother's health. Sometimes the risk can be fatal. So it's important that we classify whether you're low risk or high risk, so that we refer you to the relevant people. So the second information we're going to ask for you is your family history. Now, family history is important because of genetics. Remember, some things that your mother has can be passed down to you because of genetics and hereditary diseases. So, for example, if there is a history of twins in your family, we're going to need to know whether there is such a history in your family, so that we know what to expect. So that we also know we can send you to the gynecologist for a sonar to verify that you don't have twins, or if there's a history of congenital abnormalities in your family. So congenital abnormalities is babies born with physical disabilities. So if there's a history of that in your family or your partner's family, we also need to refer you to the gynecologist, so that you are done a sonar or a scan, so that it is ruled out that your baby doesn't have, or if unfortunately your baby also has the congenital abnormality, necessary steps can be taken. So we're gonna also ask for if there is a family history of diabetes in the family, so that we make sure that we send you to the dietitian, so that you have a diet that will reduce the risk of getting the diabetes during your pregnancy, because it can be very, very dangerous to get that during pregnancy. Also, it will help us to make sure that we remember to check your blood glucose level every time you come to the clinic, so that we prevent, or we can take steps as soon as possible when we find that now you have diabetes and you're pregnant. So another thing we're gonna ask you is whether you know what your allergies are. So for example, if you are allergic to certain medication, then we know to not give you that medication. But allergies don't have to be verified by a healthcare professional. If you know that, for example, you take certain antibiotics and then they give you rash, or they make your skin itch, or they make your throat swell and all that, then you need to tell us that, so that we are aware and don't give you those the medication that you are allergic to, and also that we note it down on your file that this is what you're allergic to, so that anybody who opens the file and sees the information, they know what not to give you and what to substitute that instead. So we're also going to ask you if you take herbal medication. Herbal medication is the medication that you get from the traditional healer. So I know a lot of women, they don't, or maybe I should say they're shy of disclosing that they do take herbal medication, but it's very important that you tell us, because some herbal medication, when you take them together with the Western pills or tablets, they can be dangerous and harsh to your liver or your kidneys. So if you have to take the traditional medicine, you need to inform us that you're taking the herbal, so that we at least check your liver function and your kidney function as well, so that we see that they're still functioning well, that there's nothing for us to worry about. So the last thing that we're gonna ask from you is the date of your last normal menstrual period. So what that means is, for example, let's say I last had my menstrual period on the 10th of March 2022, and then it's the 10th of March. We use the date of your last normal menstrual period to determine how far are you in the pregnancy. So we use them to count like how many weeks are you into the pregnancy. But if you don't know the date of your last normal menstrual period, it's also fine. We will use a tape measure to measure the abdomen. So that will also give us a picture of how far you are. That will still refer you to the doctor so that you do a sonar, so that we verify the exact date. And also, if you are not sure of the date, you think it's this date or you're not sure, it's also fine. You just tell us you think it's the 10th of March, but you're not sure, so that we still note that down, and then we send you to the gynecologist so that we verify exactly how many weeks you are, because it's very important that we know how far you are, so that we don't miss the necessary things that we check for on each pregnancy. So before I forget, I almost forgot, guys. You can also bring your partner or your friend or your mother or anybody who makes you feel comfortable, anybody whom you trust. I say trust because we are going to be asking you some personal information like current medication, the number of pregnancies you've had, if you've had miscarriages or not. So you need to bring someone that you trust, and because they can keep you company once you're waiting, or they can just relieve the anxiety and all that. But if you don't want to bring someone, it's also fine. We all have our preferences. So guys, thank you for watching. Okay guys, so thank you for watching this part 1 of what to expect on your first antenatal visit. I decided to do this video in 2 parts because it's a very long video. Like I said, there's a lot of things that we do on your first antenatal visit. So please like, comment, and subscribe, and then please look out for part 2 of this video, where I'm talking about what will we be doing to you. Because now that the asking of questions is done, now I'm gonna tell you what we're going to do to you, what to expect, and why do we need to take blood, the normal ranges of your vital signs and all that. So I'll try my best to upload part 2 of this video